helping make your life easier. Moms Every Day.
Hey everyone, thanks for staying with us for Moms Every Day. Today we are here with Dr. Yolanda Campbell, and we're talking about a very interesting topic today, and that's using robots to help perform surgeries. So Dr. Campbell, I understand that you use something called the Da Vinci robot system?
Yes.
Okay, so let's talk about how long have you been using that to perform gynecological surgeries, and let's talk a little bit about the procedure. I mean, how do you go about using the robot to perform it?
So I've been using it for over 6 years now.
Okay.
And it's pretty much got a console area, a surgeon console, where I'm using the controls and looking through a stereo microscope so that I can have 3D depth perception.
Yeah.
And then there's a separate system that's over top the operative table that has arms that are robotically controlled and have all that dexterity maneuverability that are basically doing a very high-tech type of laparoscopic surgery. So
that is amazing. It's amazing how far the technology has come. So, you know, what made you decide to start using this type of technology on your patients?
Really just seeing outcomes. One of my partners had been using it somewhat, and hearing stories from other gynecologists doing conferences, other things, and just kind of seeing how much it offered in terms of better recovery, less time away from work and away from everything that women are so busy doing, so and very good outcomes. So I was really looking to offer my patients something that was minimally invasive, and most importantly to try not to have to do open surgery, because that's really when they have the most difficulty in terms of recovery.
What are some of the different surgeries that you use this on?
Mostly hysterectomies.
Okay.
I mean, there are some others, sometimes just removing ovaries, but most often it's hysterectomies.
Okay, I'm curious because I feel like this would take a lot of training to be able to learn how to use this. Did it take you a lot of time to kind of become accustomed to using this to perform surgeries?
I did laparoscopy beforehand, so once you have that skill set, it really is. The company's intuitive, but it is a very intuitive system.
Right.
So there is very specific training that you have to go through, but I felt like it was really easy, actually, compared to some of the other things that you have to learn, just because it is just so well designed. So,
Dr. Campbell, what are some of the advantages of using a robot to perform these surgeries, let's say over performing a typical hysterectomy?
Well, a big part of it is me being able to control everything myself. Not everything, but in terms of the actual surgical, you definitely need assistance and so on, but if you're doing open surgery or laparoscopic surgery, you have to have an assistant who's skilled, and so that's always a factor. But doing robotic surgery, I have both controls. I'm using my left and my right at the same time. I also have control of the camera, and it's stationary, so it's also having the depth perception is something that we never had before doing laparoscopic surgery, not just staring at a screen without having the ability to know when you're actually touching tissue. Now you can just reach out and grab it, and it really has changed everything with laparoscopic surgery.
Wow. You know, aside from making it easier from your perspective, what are you hearing from your patients? Because they're the ones that are undergoing these types of procedures. So what are you hearing from them when they undergo this?
They are always surprised. I was surprised when patients started coming back, because the incisions don't look that different from the incisions we do with regular laparoscopic surgery. So, but having patients come back and telling me that they barely took their pain medication, that they had to stop themselves from doing things because they felt so good they wanted to do things they probably shouldn't have. So just seeing them come back and not looking like they just had surgery, that was a real, I see them back about a week or two after surgery, and many of them would say, I feel like I can do what I want to do, and you know, this is not what I was expecting. So it was surprising to me as a surgeon to see the results. And still, I still have patients that come in, and even though I've told them like this is how it's going to go, when they experience it, it's just really amazing.
Well, Dr. Campbell, thank you so much for joining us. Very, very interesting. If you at home need more information, head over to WSAZ Mobile. Just click on the Moms Everyday tab. You'll find all that there. Have a great day, everyone.